Today's Sickle Cell Disease Day. Here I just wish to summarize what every gynecologist should know. There is a high prevalence in certain communities in India. It's highly prevalent in tribal population of Chhattisgarh, Odisha, Madhya Pradesh, Maharashtra, Gujarat, Jharkhand, Telangana, and some parts of UP. Some non-tribal caste also carry this particular trait. Carriers are asymptomatic, but if two carriers marry them, then they can have 25% chance of having a baby with sickle cell disease, just like beta thalassemia. If two thalassemia minor marry, there's a 25% chance of having a sickle cell baby. Similarly, it happens in sickle cell trait as well. Premarital, preconceptional counseling is crucial in endemic areas. As a part of adolescent health programs, hemoglobin electrophoresis must be done, HPLC should be done for all girls from high-risk population. In fact, it should be done for everybody, whether boys or girls. Prenatal screening and genetic counseling is very, very important. Offer a carrier testing to couples with anemia or who have a family history of sickle cell disease. If both partners are carriers, CVS and amniocentesis has to be done between 10 to 16 weeks, and they can confirm it if the fetus is affected. As for the complications in pregnancy are concerned, sickle cell disease is a very high risk for increased chances of anemia, preeclampsia, infection, preterm labor, stillbirth, and vaso-occlusive crisis, and requires multidisciplinary management by obstetrician, hematologists, and physicians. Folic acid supplementation is mandatory because these people have a high red cell turnover. So 5 milligrams of folic acid per day is essential before and during pregnancy. Avoid triggers in pregnancy like dehydration, infections, hypoxia, stress, which can trigger painful crisis. Early management of fever and infection is also critical. Pain crisis management must be protocolized. They need hydration, oxygen, analgesics, that is paracetamol, opioids if needed, and close fetal monitoring. Blood transfusion has to have a judicious use. Blood transfusion, if hemoglobin falls less than 7 gram percent, some experts feel it should be anything which is less than 8 gram percent for acute complications like ACS or stroke. Avoid unnecessary transfusion to minimize alloimmunization. So you should be very clear when transfusion are used, they have to be used judiciously. Counsel for newborn screening and long-term care. If the baby is born to a carrier mother, screen neonate and refer for early intervention. Every child of a carrier mother should know what is the status of sickle cell disease with the child. Educate mothers on signs of sickle crisis in infants and children. Take-home messages for every gynecologist is, in Bharat, sickle cell disease is not just a hematological disorder, it is a maternal health risk, a genetic burden, a public health priority. Your awareness, screening of patients, counseling the patients can break the intergenerational cycle. Thank you very much.